Hey everyone, welcome back to the channel. Today we're diving into a topic that affects us all, healthcare costs. Specifically, we're comparing universal healthcare systems with private insurance. Which one is really more affordable? Let's break it down. First, let's talk about private insurance, the model many of us are familiar with. You or your employer pay a monthly premium. When you need care, you also pay a deductible, which is the amount you have to cover yourself before your insurance even starts to help. After that, you've got co-payments for each visit and coinsurance, which is a percentage of the total bill. These costs can add up incredibly fast, especially if you have a chronic condition or face an unexpected medical emergency. Plus, there are often out-of-network charges, and sometimes claims get denied altogether. It's a complex system with a lot of potential hidden costs. Now, let's look at universal healthcare. In this model, healthcare is funded through taxes. This means everyone contributes, and in return, everyone gets access to necessary medical services. When you go to the doctor or a hospital, you typically don't see a bill. There are no premiums, no deductibles, and no copays for most essential services. The idea is to remove the financial barriers to getting care. So, which one saves you more money? While you pay for universal health care through taxes, the overall cost to society and individuals is often lower. Why? Because these systems have massive bargaining power. They can negotiate much lower prices for medications and procedures. They also focus more on preventative care, which keeps people healthier and reduces the need for expensive treatments down the line. There's also less administrative waste since you're not dealing with hundreds of different insurance companies, each with their own rules and paperwork. In a private system, you might pay a lower tax rate, but your out-of-pocket expenses for premiums, deductibles, and surprise bills can easily exceed what you'd pay in taxes under a universal system. Think about it. A single major illness can lead to financial ruin for families under a private model. That's a risk that's largely eliminated with universal coverage. Of course, no system is perfect. Universal systems can have longer wait times for certain procedures, and the debate is always about how to fund it effectively. But when we look purely at the financial burden on the average person, universal healthcare often comes out ahead by providing more predictable costs and protecting people from catastrophic medical debt. What are your thoughts on this? Have you had experiences with either system? Let me know in the comments below. I'd love to hear your perspective. Thanks for watching, and if you found this video helpful, don't forget to like and subscribe for more content. See you next time.